With my colleagues Maurits van Selms and Connie van der Meijden, I'm very honored to speak to this audience of the International Alliance and the ALS and NMD community. We'd like to thank the APF organization for giving us this opportunity. Oral hygiene. Why is that so important for people who suffer from ALS? It might seem obvious, since generally speaking, oral hygiene is important for all of us. Preventing caries, a periodontal disease, that's disease of the gums and jawbone, well, the importance of that goes without saying. And furthermore, there's high quality evidence to support a likely association between oral health and cardiovascular disease, and between oral health and respiratory disease and others. Why is it even more important for patients with ALS to have good oral hygiene? If patients with ALS need respiratory support and tracheostomy, this may have a profound effect on the oral cavity. Patients with ALS who need mechanical ventilation may be at an increased risk of developing pneumonia, which may be life-threatening. So, paying attention to oral hygiene in ALS is important. In the case of tube feeding, however, daily oral hygiene may not always be taken into account. This may be due to resistance feelings among caregivers due to bad breath, for example, or danger of choking. In advanced ALS, it may be almost impossible to perform dental procedures such as restorations. So how to maintain this good oral hygiene? Well, the general guidelines on this look very simple. First, brush your teeth twice a day, do it for 2 minutes. Please do not forget those spaces between the teeth. Well, this is harder than it seems. We know the arm-hand function of patients with ALS may be poor or absent. The second guideline, limit your daily eating and drinking moments to at most 7 times a day. Is this hard to do? Well, actually for ALS patients it is. They need to eat and drink more often to ensure sufficient calorie intake. The third general guideline, please see your dentist regularly, is not at all that easy. Most dental practices are just not accessible to patients with ALS, if only for the design of the surgery rooms, chairs, etc. So the general guidelines hardly apply to our specific group. To investigate the problems that patients with ALS, their partners and their caregivers experience when performing daily oral care, we performed an exploratory study at ACTA in 2022. It followed a qualitative design with semi-structured interviews and video observations. Together with 2 students, we investigated 6 patients with ALS at their homes, 4 partners and 2 caregivers. This study was published in a Dutch language journal in 2023 with support from VU-Vereniging, a non-profit organization. What these interviews showed in general was that the performance of oral care is hampered by the loss of motor skills and by the gag reflex. Patients, specifically, expressed dependency on others for daily self-care. If a visit to a dentist was possible at all, patients emphasized a need for adaptations in the surgery, accessibility to a wheelchair, adaptations to the dentist's chair. And if the dentist or oral hygienist would use large amounts of water or aerosol, this would lead to gagging and discomfort. In general, patients felt dissatisfied with care. Partners and informal caregivers used various ways to help the partner or the patient with brushing and interdental cleaning. However, 2 partners sometimes felt unsure whether they were carrying out oral care in the proper way. And their oral care abilities had been learned in the past from their own dentist, from an oral hygienist, or from home. They expressed a clear need for professional instruction. 3 out of 4 partners indicated that an instructional video may offer added value. Professional caregivers, often the general practice nurse, provided active help with brushing and with interdental cleaning. They too expressed a need for training, for example, by an instruction movie. The video observations show that techniques varied across patients and caregivers. Sometimes too much force was used when brushing the teeth, as indicated by the electronic toothbrushes indicator lights. Often, brushing was too short, for example 1 minute. Sometimes only the buccal surfaces at the side of the mouth were brushed, and if the lingual surfaces in the middle were brushed, this could result in gagging. What this pilot study shows us thus far is that there's not one single way to perform daily oral care for ALS patients. It's important to be adaptive, to perform oral care according to the wishes and limitations of the patient. Training is required. For example, instruction videos or pamphlets may be useful. And knowing how to properly perform oral care on someone else makes it easier to do it under the changing circumstances and during progression of the disease. So far, the conclusions of this exploratory study. How to follow that up? Well, more research into these obstacles may contribute to the quality of life of patients with ALS. Caregivers should be empowered to provide this care with confidence. The results from the exploratory study could be substantiated in a larger study. Results should be disseminated into the international scientific community. The results should provide input to develop clinical and practice guidelines on how to provide daily oral care and self-care. An instructional video could be developed as part of these initiatives. Also, an e-module could prove to be a valuable instruction tool for partners and informal caregivers. Apart from research, what else has been done in the Netherlands on this? Well, the ALS Center, a knowledge platform by professionals and patients, has developed information for patients, relatives and healthcare providers. The ALS Patient Association also provided patient and relatives information by their website and also by information in newsletters. So what I would like you to take home from this is oral care and self-care for patients with ALS just need a bit of extra attention. Thank you very much.